Yo, Dr. Jason here. I was having a conversation last week in Naples with a patient about sleep apnea, and sometimes I forget that I say things so many different times to patients. I repeat myself so often because I'm trying to educate patients that I just assume that everybody knows. But I'm going to assume that everybody doesn't know when it comes to sleep apnea. So I just want to spend a few minutes talking to you about what sleep apnea is and how serious it is, what your options are, stuff like that, right? So in a very, very summarized description, obstructive sleep apnea is when the tissues in your mouth and in your throat, your tongue, soft palate, larynx, collapse on the airway. So you're sleeping on your back like this, and all of those tissues kind of fall back. So you're not getting enough oxygen into your lungs. And when you don't get enough oxygen in your lungs, there's this automatic reflux where you stop breathing. For some people, a significant long time, and for other patients, many, many times throughout an hour. Anywhere from 15 to 20 times an hour, all the way up to 200 an hour. It's crazy. It's really, really, really bad for you, okay? It's like the silent killer. You're not allowing oxygen to get to your body. It's not funny in the sense that, oh, my husband snores. I just hit him and he turns over and he doesn't snore as often. It's not like that anymore. Like, we're educated enough now where we understand exactly what it is. We understand how it works, and we understand that it's literally taking years off your life. So like high blood pressure, you don't really know you have it until you get tested. And that's also called the silent killer. Sleep apnea is a big deal. So it's time to really take it serious. So if you're with someone that snores a lot at night, stop joking about it. Stop just hitting them and having them turn over. Get them to get serious about it. So what does that mean? Well, talk to your doctor about it. First and foremost, there's different ways to get diagnosed. You can go through a sleep study at a local hospital. You can do some at-home sleep studies, and I can help you understand that. Once you get diagnosed, now you have to decide how you want to get it treated. And I like to tell patients that each treatment option comes with a letter grade, right? So a Cpap machine, the thing that kind of goes over either your nose or your mouth or your nose and mouth, it forces oxygen down your trachea into your lungs, okay? It works really, really well. If we had to give it a letter grade, it's like an A, okay? It is the gold standard for treatment. And if you can find someone to work with that can fit you properly and you can tolerate it, then that's what you should do, okay? It's a no-brainer. What are the issues with it? Patients hate it. So everyone I run into, maybe 2 out of 10 that have a Cpap machine, they actually use it, and they use it routinely. It's loud. It's disgusting to clean. It really affects intimacy. It's impossible to travel with it. So there's a lot of disadvantages to a Cpap machine. But let me be crystal clear. It is by far the gold standard when it comes to treating obstructive sleep apnea. So what if you can't do the Cpap machine? What should you do? Well, there's a fancy device that your dentist can make. It's called a mandibular repositioning appliance, right? And unlike the Cpap machine that forces oxygen down your throat through a machine, it actually repositions your jaw so your jaw is a little bit more forward. And when it's forward, the tongue and the soft palate and all of these muscles in here get off of your trachea, and now you can start to get oxygen much more accessible, okay? It works well. Does it work as well as the Cpap machine? Absolutely not, right? So if gun to my head, which one works better? CPAP machine works much, much better. So, but here's the rub, right? The CPAP machine is a letter A. The mandibular repositioning appliance, any type of sleep apnea type of appliance that your dentist can make, is a B. But guess what's an F? Doing nothing, or having a CPAP machine that collects dust in your corner. So I make a ton of mandibular repositioning appliances for patients. They come in, they say they try the CPAP machine and they struggle with it. And I need to commend them, and I do, because, okay, awesome. I'm so glad you tried the gold standard, and I'm so glad you realize how important it is to get treatment even though you've tried the CPAP machine and you're simply not compliant with it. So I can answer many more questions about this. If you guys have questions, put them in the comments or give me a call. But just in a nutshell, obstructive sleep apnea is a really big deal. Stop joking about it. Stop kind of saying, oh, my husband, he snores, I just knock him. Get over that mindset, okay? It's a big deal. It's taking years off people's lives that go untreated. So realize it's a big deal. Get diagnosed, okay? Get treated. And once you get treated, realize that the CPAP machine is the gold standard. If you can wear the CPAP machine and you can tolerate the CPAP machine, wear the CPAP machine. But if you can't, talk to your dentist about a mandibular repositioning appliance, because no, it's not as good as the CPAP machine. It's not a grade A, but it's a grade B. And doing nothing is a grade F. Doing nothing is taking years off your life, and you're going to leave your loved ones sooner than you really should because you joked about how serious sleep apnea was. All right, guys, thanks.